For Your Mental Health, brought to you by Barber Behavioral Health, a service of Barber National Institute.
And we're going to welcome in our guest today. Colleen Hanson from Barber Behavioral Health is here to talk with us today on our weekly segment For Your Mental Health. We're talking today about infant mental health, and Kara and I have many questions about this.
Yes. So just real quick, when we look at that time period of development, it's infancy through those preschool ages. So birth up through like 5-6-year-old age.
We've talked in previous weeks about how early intervention can really help. So this is really early intervention.
Yes.
So what is infant mental health? What are we looking for here?
So infant mental health really is just this practice, and it's a proactive measure of safeguarding a child's mental health and what the adults can do to do that and support that. Pretty much what the parents can do to really help support their social and emotional development.
What are some things that that you might see that would be warning signs that I'm thinking of babies. Obviously, as they get a little bit older and they start to talk, you can kind of tell. But when they're just babies, how can you tell that there might be something off?
So when we look at babies and infants, really we're looking at, are they beginning to make interactions with that adult, right? It's kind of this idea of a serve and return. So maybe if mom is talking to the baby, getting really close, maybe that baby might coo, make a sound, maybe kick their leg, right? And then mom would go back and maybe start to provide another interaction. So sometimes with the very young children, it's if we're not seeing those interactions for attention, right? With young kids, they thrive off of those interactions with mom and dad.
And so some of this can seem really insignificant, but it's not when we're talking about babies, right?
Yes, and I think too, looking at the history of infant mental health, really it goes really far back at, there was a time where people didn't think that their infants and their babies were active participants in their development. They were passerbys, but they really are. They're observing, they're watching the big people. A newborn, their ability to see in their sight is as far from where you hold them. So thinking about that, thinking about them beginning to look in and cue in on mom's face or dad's face, it's really the start of that healthy development.
Right, like that, watching the big people.
Yes, and how important it is to foster that as well.
Yeah, so what are things that parents can do besides just, the little conversation?
Well, the big thing is just building that relationship. Play is a child's work, right? So engaging in your child's play is probably a very important thing, one of the most important things you can do. And very simply so. A simple game of peekaboo, if you think about that, there are so many things that are happening. We're doing turn taking. Mom is covering her eyes, the baby's anticipating for that surprise. And then the baby might smile or make a sound. And when that happens, they're learning not only this interaction, but it's setting them up for future development, like communication, right? That turn-taking we have when we talk to one another. Also cognitive development, waiting for that time. So those simple little play activities, and even just in seeing what your child is interested in doing and following their lead. Building fun and healthy interactions throughout those everyday routines. If you think about a life of a baby, one of the biggest routines is diaper changing, right? We do that how many times a day with our kiddos? A lot, right? I have 2 twin boys, so we had a lot of diapers. Making that time fun, your kiddos has their little feet and their little legs, counting those toes, counting those fingers, talking to them. These simple interactions are what really matter at that time.
And real quick, if you're not seeing the reaction that you think would be normal, what do parents do?
Well, first thing most parents do is they contact their PCP, right? Usually during those times they bring their child in for their physicals. There's a trusting relationship with that physician, and I think the first thing to do is ask them about what is early intervention. Early intervention is a program that is throughout our nation. Every state has one, and early intervention is a program that helps families foster development when development goes awry. So
interesting, all very interesting. Colleen, you were great. Thanks so much for joining us. We put up the number not too long ago for Barber Behavioral Health. Could be a first step for lots of families.
Thanks, Colleen.
Great.
Thank you.
Thank you very much.
We're going to send it